Hello, love. How are we doing today? Doing okay? Good. Well, I'm going to be your nurse today before the doctor comes in. I'm just going to take some of your vitals and see how we're doing before you get your overall complete exam. Okay? Great. Yes, so I'll be your nurse. And if you'd like, we are going to start taking your regular information so we can check you in and make sure we are doing everything accurately. Does that sound okay? Okay, great. Alright, so let's start with your name. Yeah, first, middle, last. Perfect. That's a long name. Yeah. And what is your date of birth? Month, day, and year? Okay. Okay, perfect. And how overall are you feeling? Like on a scale from 1 to 10, or with 1 being the worst and 10 feeling really good, how are you feeling on the pain level right now? Okay. Okay. And what were you being seen today for? Okay. Just double checking. Now, are you in any sort of danger or harm? Is someone trying to come after you? Do you feel threatened at all? Okay. Just regular precautions. Now, do you have any allergies to any medications or painkillers or anything like that? Alright. I guess that would include latex as well if you're allergic to that. Okay. Now, are you currently on any medications currently? Okay. Now, what is your diet and exercise lifestyle like? Okay. Well, that sounds good. Great. Okay. And a couple more, sorry. What are some other, have you gotten any injuries recently? No? Perfect. Were there any big previous injuries that could maybe hinder your ability to walk or run or just overall mobility just in the past? Okay. Okay, great. Okay, well that'll be all the information that I need right now from you. And I'm going to start with taking your heart rate and pulse, and then I'm also going to listen to your lungs and your breathing, and then we're going to check your reflexes real quick, and then we're also going to lay you down and I'm going to feel around on your abdomen and your chest to make sure everything feels okay, that there aren't any lumps or extra swelling or maybe some sensitive pain or places that are just not very comfortable. Okay? Alright. Well, let me get my things and I will be back in just a moment. First, I'm just going to put on some gloves, okay? And then I'm going to put some antibacterial gel on it, just to make sure we are as sterile as possible to keep everyone healthy. especially with the summer months coming up. We do not want to be getting sick. Okay. Alright, perfect. It's a strong smell. Yeah. Okay, if you could just give me your wrist, then I'm going to take your pulse real quick, and then I'll check your heart and your lungs. Okay? Thank you. Good. Let me just write that down. Got a nice heart rate there, or pulse, pardon me. Okay. Alright. This will be nice and quick. Okay, I'm just gonna come up right here next to you, okay? Okay. Sounds good. Nice and strong. Good. Good. Alright. Now I'm going to listen to your lungs, okay? Just so we can make sure that there are no murmurs or anything like that, making sure they're flowing nice and smoothly. Okay, so I'm going to come over on this side, and then I'll switch and then go behind you as well. Okay. Okay, now I need you to take a nice deep breath in for me. Good. And in again. And out. Good. Now I'm just going to reach around to the back. If you could take a deep breath in. Good. I think that all sounds really nice. Let me do the other side real quick. Okay. Now take another deep breath in for me. Good. Now I'm going to reach around to the back. Good. I think that all sounds really nice. Yeah. I didn't hear anything abnormal. Nice, strong breathing. Yes. Now, do you smoke? Okay. Just thought I'd ask just in case so we can keep it on record. Do you vape or inhale anything regularly? Okay. Besides oxygen. Okay. Okay. Now I'm going to come a little bit closer to you if you don't mind. And I'm going to check your eyesight just a little bit to see if your reflex was okay. Then I'm going to check in your ears, and I'm also going to check in your mouth just to make sure that we've got everything working correctly. Okay? So I'm just going to get my little light out. I hope it's not too bright. It's pretty new, so it hasn't been used very much. So let me adjust it here. Okay. Now, you just have to be relaxed. Maybe you try and keep your focus on me, but make sure not to look around too much as I'm trying to make sure that your pupils are dilating correctly, okay? Okay, great. Now, just focus on me, I guess that'd be fine. Yeah. Okay. Good. Nice. You're doing great. Yes. Good. Straight on, straight off. Good. I think that looks fine. Yeah. You're in great health so far. Yeah. Alright. So if you could just open your mouth for me, and I'll just check your teeth and your gums and make sure that everything else along the wall and your cheeks look okay. Alright. Right, so yeah, open your mouth for me. Good. Let me know if it gets a little uncomfortable. Just trying to make sure we cover all the bases here. Good. Yes. Good. Sure. The bottom there, and the top. Okay. Let me get one more. Okay. Yeah. No, you look totally fine. Yeah, maybe there was just some slight swelling towards the back, but I think it's okay. Yeah. So next I'm just going to check your ears real quick, just kind of looking on the outside. The doctor can do a much more thorough examination. I'm just going to make sure that there's nothing too prominent and make sure that there's nothing to worry about. Okay. So yes, I'm just going to come over here to your side and just see how everything is. Okay. I don't see any swelling. Have you had any problems with your ears in the past? Okay. Okay. Well, that ear so far looks very good. Nice and light pink, no swelling or redness, anything pus filled, nothing like that. Okay. So I'm just gonna check this one and then we'll move on. Okay. This one looks nice as well. Very good. Yeah, they look beautiful. You've been doing a good job with them. You're nice and clean and healthy. Yes. I'm just going to write down information that I've been taking as for the doctor, and then we'll move on. Okay? Great. All right. So now I'd like to lay you down, and then we're going to feel your abdomen and your chest. And I'm also going to feel around your neck and your lymph nodes right here, just to make sure there's no extra swelling, or if one's standing out, then maybe we need to check that further. Okay? Okay. So let's lay you down, and we'll go from there. How was that? Is that more comfortable? Okay, good. Yes, I thought that this was quite a bit more comfortable than sitting. Yes. Okay, so if you don't mind, I'm just going to sit right here because I feel like I'll be able to get a little more in depth and get more feeling of what I need, okay? Alright, so I'm going to remove my gloves. And then I'm going to start feeling on your chest and stomach, and your thyroid and lymph nodes. So first, let's make sure that you're comfortable, okay? Does that feel alright? While your toes. Grab your shoulders a little. Okay. Alright, so I'm going to start with your chest, and then I'm going to move to your abdomen, and then I'm going to go back up towards your thyroid and neck and lymph node area. Okay, so let me know if anything stands out that maybe you're not comfortable with, or there's pain, or any other thing that stands out. Okay, wonderful. Okay, just let me know, and I'll just start going down automatically. Okay. Okay. How's that? Little tender. Okay, let me take note of that. Okay. Okay, let's put that on that other side. Alright, so I'm gonna feel there again. Let me know if it gets worse or it's better. Okay. I'm gonna come over to your other side. How's that? Oh, you'd like to be adjusted a little bit more? Okay. Here, let me help you one moment. How's that? Is that a little better? Okay, great. Alright, now let me get started again. That feel okay? Still okay? Okay, good. Alright, let me just stand up, and I'm going to get a different angle. I'm going to press a little bit harder than usual. Maybe too hard. I'll go a little softer. Okay. Alright, now I'm going to move back to that area that you said was a little sensitive. Let me know if anything changes or if it still feels about the same. Okay. Keep note of that, okay? We'll let your doctor know. You feel somewhat hungry. Yeah. A little nervous. It's okay. Feels kind of nice. Okay, good. Okay, good. Alright. Now, I'm going to check your neck and your lymph node area just to make sure that they're not too swollen and of making sure that they're a normal size. And if they are swollen, what we could possibly do to see if there's something else going on. Okay. Alright. I'm just going to come a little closer and I'm just going to start feeling right down, right about right here. Where your thyroid is. And I'm going to start feeling these lymph nodes right here. Okay. So let me know. Okay. Maybe a little, just a touch. I don't think it's anything to worry about. Yeah. I feel right here. Yeah. They're sometimes weird to feel. We have quite a couple right here. Usually when you get sick or you have a cold or something, these get a lot more swollen and they can even become somewhat sore. So we need to kind of watch out for that. But yours actually feel very normal, so you must be in very good health. Yeah. I think you're alright. I think you're gonna live. Alright, so for me, I think that will be the end of your examination, at least from a nurse's perspective. The doctor will be in with you in just a few moments after they finish with some other patients, okay? Yeah, so just stay here. You can use this nice blanket and stay comfortable. They're just going to go over some more extensive questions that I kind of asked you, and then you can have a nice rest of your day. Okay? Great. Well, it was nice meeting you. Thank you for being so cooperative and just a pleasure to be with. Okay? Great. Right. You have a wonderful day, and I will see you later.